Human reproduction seems straightforward on the surface, but in reality, it involves a tactily coordinated sequence of biological events. Getting pregnant might seem simple, but there's actually a whole chain of things that need to go right, starting with the sperm finding the egg, and ending with the embryo successfully implanting into the uterus. In the presentation, we'll talk about how fertilization and implantation actually happen, what might go wrong, and how treatment like IVF can help when natural conception doesn't work.
What is fertilization? Fertilization is defined as when the sperm from the male meets with the egg cell from the female to form a zygote, marking the start of pregnancy. Fertilization occurs after ovulation, when the egg has been released and swept into the fallopian tube. The path of the sperm can be seen right here, where it travels to the vagina, the cervix, the uterus, and finally meets the egg at the fallopian tube. The sperm goes through two changes to penetrate the two layers of the egg, which are the corona radiata and the zona pellucida. The two changes involve capacitation and then the acrosome reaction. Capacitation starts with cholesterol loss, which increases the membrane permeability of the sperm. This causes the influx of Ca2+ and HCO3- into the sperm, triggering a series of reactions, which ultimately leads to increased sperm mobility. Capacitation is then followed by the acrosome reaction, where the plasma membrane of the sperm fuses with the outer membrane of the acrosome. This releases digestive enzymes such as hyaluronidase and acrosin, which helps penetrate the inner layer of the egg.
Implantation is the process in which a blastocyte is attached to the endometrial surface of the uterus and invades the epithelium. This will occur after fertilization. Before the blastocyte and endometrium can initiate implantation, the window of implantation has to occur, which is the crosstalk between a receptive uterus and a blastocyte, and can only occur during a limited time. To achieve implantation, hormones such as estrogen and progesterone binds the receptive nuclear receptors. This step is important as this is a way for the embryo to be connected to the blood supply, receiving nutrients, enabling the placenta to be formed. Without the successful implanting of the blastocyte, the embryo will not be able to receive the support it needs, leading to the termination of pregnancy.
Let's see what infertility is first. According to David Earshaw's definition, infertility is when a couple is unable to get pregnant after a year of regular unprotected sex, and 1 in 6 people have experienced infertility in their life stage. It can affect both males and females. In males, one common cause is varicocele, which is a swelling of veins in the scrotum that can damage sperm. In addition, hormone problems like low testosterone can also reduce sperm production. Other causes include undescended testicles, past injuries, or infections that affect the testicles, destroying tissues that produce sperm. Some men may also have sperm issues, like low sperm count, poor movement, or abnormal shape. Moreover, lifestyle factors like smoking, alcohol, obesity, and stress can also lower sperm quality. In females, ovulation problems are a major cause, especially in conditions like PC, polycystic ovarian syndrome, where eggs are intralaced regularly. On the other hand, blocked fallopian tubes, often caused by infections or endometriosis, can stop the egg and sperm from meeting. Some women also have issues with the uterus or lining, such as fibers or a thin endometrium, which can make it harder for the fertilized egg to implant. Moreover, endometriosis, where tissue grows outside the uterus, can also cause pain and scarring that interfere with fertility. Lastly, much research has suggested that both males and females' age and lifestyle can highly affect sperm and egg quality, causing infertility. So if you don't want to be 1 in 6, please have a healthy lifestyle.
Infertility can be overcome through multiple ways, but IVF or in vitro fertilization is the most effective treatment in overcoming infertility. IVF involves fertilizing an egg with a sperm in a lab dish and then placing the embryo back into the woman's uterus. Now, to encourage the ovaries to generate multiple viable mature eggs, the procedure starts with hormonal injections such as FSH and LH every day, once or twice for 8 to 14 days. When the eggs are mature, more hormone-stimulating shots are administered, and an ultrasound-guided needle is utilized to remove eggs from the ovaries. Simultaneously, a sperm sample from the father or donor is taken and is fused with the retrieved egg from the uterus in the lab. The woman's uterus receives the transfer of 1 or more healthy embryos via fresh embryo transfer or frozen embryo transfer. Now, fresh embryo transfer is the transfer of embryo 3 to 5 days after fertilization back into the uterus. but frozen embryo transfer is freezing the embryos fertilized and inserting it back into the uterus later on. Now, approximately 2 weeks after, progesterone and other hormones are administered to the mother to aid implantation, and a blood test by the end of it determines whether pregnancy has taken place.
So ultimately, successful human reproduction depends on precisely coordinated sequence of events, from gamete quality and hormonal regulation to uterine receptivity and embryo development. When disruptions occur, whether due to anatomical obstructions, impaired gametogenesis, or endocrine dysfunctions, fertility is compromised. This is precisely where biomedical research and reproduction technologies have stepped in, transforming that was once considered a biological limitation into a clinical challenge that we can now address. IVF may not be a perfect solution, but for many people, it makes impossible possible, offering new hopes to couples dreaming of becoming parents.
Girl, no.